Good afternoon. I'm Dr. Michael Schreck. I'm a hand surgeon with OrthoVirginia, and I practice in Loudoun County. So today I'd like to spend a few moments speaking with you about some common conditions that I see in the office. So we have a little outline that includes carpal tunnel syndrome, trigger finger, tendonitis, and then we'll talk about fractures. So carpal tunnel syndrome is known as a compression neuropathy. And what occurs is compression of the median nerve at the wrist level. And we'll show a subsequent picture with this in a slide. This is the most common compression neuropathy. And so what we see here is a schematic of the wrist. And so this is a cross section of the wrist. The structure in yellow is the median nerve, and the tissue overlying that structure is the transverse carpal ligament. And so what occurs in carpal tunnel syndrome is the transverse carpal ligament is too thick and causes compression upon the nerve. So this nerve compression leads to symptoms of numbness and tingling, pain, weakness, and clumsiness as you progress into advanced stages. The symptoms are primarily in the thumb, index finger, middle finger, and half of the ring finger. We'll go to the next slide now. And so this is just a diagram showing where the symptoms are most commonly located. Again, the thumb, index, middle, and half of the ring finger. So why this occurs is not entirely understood. There are several predisposing factors, including diabetes, hypothyroidism, alcohol use, obesity, tobacco use. Women get this more commonly than men. It is also associated with pregnancy, rheumatoid arthritis, and of course, repetitive motion activities. Next slide, please. And so diagnosis is typically clinical. So the symptoms can be reproduced by performing certain maneuvers upon examination, such as tapping on the wrist over the nerve in this area here, compressing the nerve on the wrist, or also performing hyperflexion of the wrist. All of these maneuvers increase the pressure on the nerve. And then once you have a clinical suspicion that there is in fact carpal tunnel syndrome, the next step is typically to order a nerve test, which can then quantify the degree of damage to the nerve. So as far as treatments for carpal tunnel syndrome, there are some conservative treatments which are not curative. They include cortisone injection and bracing. I will say I don't typically inject with cortisone unless there's some reason that the patient can't undergo some sort of a surgical procedure, which leads me into the surgery. So the curative procedure is a carpal tunnel release. There are two techniques through which the carpal tunnel can be released. There's the open technique and there's the endoscopic technique, which we will show on a subsequent slide. So the left side of the picture shows the open release, and then the right side shows the endoscopic release. The open release is performed through an incision in the palm. This is pretty standard. And then the endoscopic release is slightly newer. This is done through an incision in the wrist, through which an endoscope with a blade is placed into the carpal tunnel. You visualize the transverse carpal ligament through the camera and then deploy the blade, thereby releasing the nerve from the inside. I favor this technique because it tends to be a little bit less traumatic to the tissues. So now we'll talk about trigger finger. Trigger finger is very, very common. The technical term is stenosing tenosynovitis. So this is entrapment of the tendon. So what occurs is mechanical impingement of the flexor tendons as they pass through a narrowed pulley or tunnel. And we'll show you a picture of this on the next slide. So what we see here in this picture is the tendon trying to glide through the flexor pulley system or tunnel system. And so what happens is an area of focal swelling in the tendon causes the tendon to get stuck at the tunnel there. This leads to symptoms of catching and popping, which can be painful. And in severe cases, the finger can even lock down and get stuck in flexion, requiring manual manipulation to extend the finger. Next slide, please. Why this occurs, again, is not entirely understood. Inflammation tends to be what's most commonly cited. There are predisposing factors to trigger finger. Women get this, again, more commonly than men. Age 55 to 60 years, diabetes, gout, kidney disease, rheumatoid arthritis. I should mention I myself have had trigger finger before, which will lead us into how we treat this. Next slide, please. So, diagnosis of trigger finger is entirely clinical. Typically, you'll have pain in the palm over what is known as the A1 pulley region. So we see in this picture here The little rectangles with the hash marks there, that indicates the A1 pulley region. That's the tunnel that the tendon is getting stuck on. And in that tunnel is where the tendon gets caught and then causes the catching and locking. Next slide, please. So treatment. So this slide depicts exactly what I underwent. So cortisone injection is the first line of treatment for a trigger finger. This leads to roughly 70% success rate. So I had mine injected about 8 years ago. It's never come back. As far as splinting is concerned, I don't know many hand surgeons that utilize splinting. You can do this, but it's not commonly used. And then next slide. So then surgery is indicated if you fail conservative treatment with the injection. And so this is a picture. Trigger finger release being performed. It's just a small incision made in the skin and then a small incision in that little tunnel, and you open up that tunnel so that the tendon can glide freely. Next slide, please. So we'll talk a little bit about tendonitis and one specific form of tendonitis in the wrist. So this is a continuum of stenotic conditions. We just previously discussed trigger finger, which is a stenotic condition. Tendonitis also is a stenotic condition in which tendons become inflamed and entrapped within their compartments. Next slide, please. So we'll talk about de Quervain's disease. This is very, very common. One of the most common forms of tendonitis. So we call this stenosing tenosynovitis. There's that term again, of the first dorsal compartment. So what we see in the picture here is a diagram of the first dorsal compartment. That's just a term for the compartment in which these these extensor tendons live. So there are two tendons that go out to the thumb that get entrapped in this area and become inflamed. Next slide, please. So de Quervain's disease, again, is more common in women, tends to peak during childbearing years and perimenopausal years. It can be associated with pregnancy, again, as carpal tunnel can be associated with pregnancy. It's also associated with diabetes. And so this leads to pain on the thumb side of the wrist. Next slide, please. So diagnosis of de Quervain's disease is typically made with this maneuver in this picture here. So you grab the thumb like this, and the examiner moves it into ulnar deviation is what this motion is called. That causes significant pain, and that makes the diagnosis of de Quervain's disease. Next slide, please. So there are conservative treatments, including anti-inflammatory medications, activity modifications, thumb bracing, and then corticosteroid injection, cortisone injection. That is what I most commonly employ in addition to these other measures. Cortisone injection, 1 to 2 injections, is typically about 80% effective at curing symptoms. Next slide, please. And then if symptoms are not alleviated by conservative means, we perform surgery. And this is a little picture here, an incision made over the thumb side of the wrist in order to release those tendons from their sheath, thereby not allowing them to rub up against each other anymore, and it stops the inflammation. Next slide, please. So lastly, we'll talk about fractures. Fractures are broken bones. We're going to discuss one specific fracture called a distal radius fracture, or also commonly known as a wrist fracture. So this is one of the most common fractures of the musculoskeletal system, and it's typically caused by a fall on an outstretched hand or wrist. Next slide, please. So here's the X-ray appearance of the distal radius fracture. And so what the term means is, distal means it refers to the location of the fracture. So distal means that it's far down the bone. Radius, this is the radius bone, and then fracture, the bone is broken. So that's what the term means. Next slide, please. So as far as treatment for a distal radius fracture, in youngsters or in fractures without too much displacement or angulation, you can manipulate the bone back into position. This picture here depicts a manipulation or reduction maneuver being performed, and then you would place a cast over top. Next slide, please. And so in fractures in which the manipulation has failed, or in fractures in which there's too much angulation, you would then perform surgery. And so this slide here demonstrates where the typical incision would be for fixation of a distal radius fracture. And then these X-rays demonstrate a plate and screw fixation construct placed to hold the bone in the appropriate anatomic position such that it can heal appropriately. Next slide, please. All right. Thank you for your time. So now we can address a few questions.
Thank you so much. We do have some questions coming in. Please feel free to put questions in the comments. And we had some questions that people asked as they registered. So one question about trigger finger. Is it common to have trigger finger in more than one finger on the same hand?
Yes, that can happen. And I please that commonly. Absolutely.
So is there a specific finger splint or anything you specifically recommend for trigger finger to avoid surgery if somebody's really anti-surgery?
That's a great question. I don't typically treat with splints. I also don't really know many hand surgeons who do. In the slide, I had mentioned that you can splint in a certain degree of flexion to try to combat the trigger finger by not allowing it to trigger, essentially. Really, my recommendation would be, if the cortisone hasn't worked, to speak with a hand surgeon about potentially undergoing the procedure if you're well enough to do so, because really the procedure is curative and it is a minor procedure. It can even be performed without going to sleep under anesthesia, under just local numbing medicine.
Thank you. Is it better to treat hand issues with heat or with ice?
Great question. So I typically recommend ice for things that involve inflammation. So for example, something like de Quervain's disease, in which the tendons are inflamed. In addition to the things that I mentioned, cortisone injection, anti-inflammatory medications, bracing, ice is more helpful for inflammatory disorders because the ice acts to decrease the inflammation. Now, if you're suffering from an issue that causes stiffness in the fingers or wrist, I tend to recommend heat for those issues because the heat will warm up the tissue such that you can move a little bit better.
Thank you. For conditions like trigger finger or carpal tunnel, are there any exercises that can be done at home?
Great question. So for carpal tunnel syndrome, there are some exercises referred to as nerve glide exercises, in which it involves certain stretches, with the idea being that you can get the nerve to glide a little bit better and decrease the compression. That being said, nerve glides really only work in early stage disease. As carpal tunnel syndrome progresses, really the nerve glides don't work that well, but certainly that's something that I have had patients look up on the web, or they actually see a hand therapist or physical therapist for that. As far as trigger finger, there's not really any exercises, unfortunately.
Thank you. Do you treat Dupuytren's disease?
I do.
Can you explain a little bit about what it is?
So Dupuytren's disease, so we sometimes refer to that as Viking's disease because it's very common in people of Scandinavian descent. So what's involved in Dupuytren's disease is there's an abnormal proliferation of what's called the palmar fascia. So it's the tissue in the palm deep to the skin. This tissue abnormally grows and can cause contractures of the fingers. So this can be treated in a number of ways. Once there is progression to a certain degree of contracture of the fingers, typically it goes untreated until you reach about 30 degrees of contracture at either this joint or this joint. Treatments typically include some less invasive therapies and modalities versus surgery. So there are certain injections that you can perform to treat Dupuytren's. These are called Xiaflex injections. You may have seen commercials for Xiaflex. I know John Elway, who used to play quarterback for the Denver Broncos years ago, has done commercials for that. There's also small, minimally invasive techniques that you can utilize to break up the tissue. And then there is also surgery, in which you perform a radical resection of the tissue in order to straighten the fingers out. Any one of these treatments then is typically followed by hand therapy in order to keep the fingers straight so that they don't contract back down over time.
Thank you. Once an incision is made for a carpal tunnel release, will the tunnel ever heal or will it always be open?
Great question. So what happens is, think of my fingers here as the transverse carpal ligament, and then you make the incision and the ligament opens up wider. And then what happens, you heal over and scar tissue forms over there. So the tunnel remains open more after the surgery, and then some scar tissue or healing tissue forms over top. So this leads me into another topic, recurrence of carpal tunnel syndrome after release. It's very, very, very uncommon for that to occur. It can occur in very rare situations. Many times if I see a patient who has recurrent symptoms, usually it's because there was an incomplete release performed. Typically, once you have the surgery, it doesn't come back. The tunnel does heal, it just heals it more wide open, so there's more space for the nerve.
Thank you. How do you regain strength in your hands to be able to open bottles and jars?
So that really depends upon what the nature of the issue is, why you can't open the bottles and jars. Is it from a nerve-related issue like carpal tunnel syndrome that's caused weakness in the hand due to compression of the nerve? Is it an arthritis issue? Certain topics we didn't touch upon today include arthritis. Arthritis can cause pain and weakness in the hand that can result in difficulty with using the hand for certain activities, which were mentioned in the question. So really it depends upon what the cause of the weakness is, and then that guides the treatment. And then certainly on top of, understanding what the cause of the weakness is, once that's been treated, then if you continue to have issues, such as, for example, after you perform a surgery for arthritis of the base of the thumb, we'll say, that also requires physical therapy and hand therapy afterwards to regain strength.
Thank you. If somebody's fingertip feels tingly, what causes that and how can it be treated? And does the cause vary by finger?
So, great question. There could be a couple different reasons for this. Typically, it's going to be something nerve-related. Carpal tunnel syndrome, as we discussed, involves the thumb, index finger, middle finger, and half of the ring finger. So if any of these fingertips are tingly, it could be carpal tunnel syndrome. There are other reasons that you could have tingly fingertips. It could be a circulation issue, which we didn't really touch upon in today's topics. It could be just an issue isolated to the finger. Maybe there's a digital nerve issue involving one of the nerves specific just to the finger. Now, on the back half of this question, there are other forms of nerve compression that can cause tingling in other fingers. So, cubital tunnel syndrome, which is nerve compression at the elbow, can cause symptoms in the small finger in this half of the ring finger. So that was an outstanding question because carpal tunnel syndrome typically affects out to here. But yes, other nerve-related issues such as cubital tunnel syndrome affect the other fingers.
Thank you. Can you briefly touch on how you diagnose arthritis in the hand and what can be done to treat it?
So, great question. Arthritis typically is going to be diagnosed with an x-ray. So I would get an x-ray of the hand or whatever the involved joint is. Certainly clinically, when you examine a patient, there are certain signs you can look for that will tip you off to that. You can have swelling in certain joints in the fingers or hand. You can have certain deformity of the hand, which may tip you off, but typically the x-ray is going to be the definitive diagnosis. And then, I'm sorry, what was the next half of that question?
Just a brief overview of treatment, please.
So as far as treatment is concerned, typically I try to start with conservative treatments and then escalate as needed until we get to potentially surgical treatments. So typically for arthritis, I recommend anti-inflammatory medications. These can be as simple as over-the-counter Motrin or Aleve. For symptoms that are quite severe with arthritis, sometimes I will use prescription medication like naproxen or meloxicam. As symptoms tend to progress, I will employ things like cortisone injections right at the joint to help with symptoms. We can also do things like hand therapy as well as bracing. And then once we get to an end stage, then that's when we start to talk about surgery. Once all the conservative things don't work, which hopefully work for years, then we talk about the surgery. And the surgeries vary by joint. You can do things such as joint replacements, fusing the joint together, meaning getting the bones at the joint to knit together so it doesn't move anymore. And then very specifically for thumb base arthritis, there's a procedure performed in which you remove the bone. I have a little model here that I can show you. You remove this bone here at the base of the thumb and then stitch some tendons together in its place to fill the void. And that procedure is performed for thumb base arthritis.
All right. Thank you so much, Dr. Schreck. That is all of the time that we have for today. Would you like to close?
Thank you so much for having me on. I really appreciate your time. I'd be happy to treat anyone. Please come see me at either of my offices. I have an office in Ashburn as well as in Aldi, at Stone Springs, just above the library.